Hello everyone and welcome back to my channel. Myself Dr. Subisani. Hope you are doing great. Now today I come forward to talk about another oral pathology topic, that is the dens invaginatus. It is also known as dens in dente. This is the first another name, and the second name is the dilated composite odontome. Now basically it is the invasion in the surface of the tooth before the calcification takes place, right? Or it is defined as the deep invagination in the crown or the root area of the tooth, which is lined by enamel only. If we talk about the etiology of this condition, that is dens in dente, or we can say the dens invaginatus, so the etiological factor is due to the increased localized focal pressure or the focal growth retardation or the focal growth stimulation in the certain areas of the tooth bud. Second etiological factor is the malformation that begin in the developing enamel organ when the cells near to its deeper surface proliferate and invade into the dental papilla, right, with the connective tissue as well as the blood supply, which they are getting it from the external follicle. Now the types of dens invaginatus, it could be coronal or the radicular. So there are two types of the dens invaginatus. One is the coronal dens invaginatus, second is the radicular dens invaginatus. In case of the coronal dens invaginatus, it is further divided into three types. First one is the type 1, which is the invasion that is confined to the crown. So of the type 2, there is the invasion that extend below the cemento-enamel junction and end in the blind act, which may or may not be communicate with the adjacent dental pulp. Types of the type 3, the invagination extend up to the apex of the tooth without any communication with the pulp that can lead to the inflammation in the periradicular area. With the presence of the vital pulp. Occasionally, the invasion appears to be very large and it appears to be tooth within a tooth. That's why it is known as the dens in dente. On the other hand, it is also appear as an analogous structure of a tooth. That's why it is known as the dilated odontome. Now, if we see the clinical feature, then clinically, most commonly, the permanent lateral incisors are involved. Second, usually a deep lingual pit is there, developmental lingual pit is present. Which clinical and the radiographic feature is that most commonly the permanent lateral incisor tooth are involved. Second, a deep developmental lingual pit is present. Of invagination varies from a slight enlargement of the cingulum pit to the large extension or the invading or the enfolding that extend up to the apex of the tooth. Before eruption of the tooth, there is the lumen present in the invagination that resembles the dental follicle. After eruption or on eruption, the soft tissue get necrosed. Eruption, the soft tissue lose its vascularity and get necrosed. Radiographically, there is the pear-shaped tooth appearance is there radiographically. Radiographically, pear-shaped invagination of the enamel and dentine is there with the narrow constriction or at the opening of the surface of the tooth and approximately the pulp at its depth.